There's encouraging news for cancer patients to help manage their bone health. New data presented at a major medical meeting shows that people with cancer may be able to help prevent the spread of it to their bones, but also to maintain bone integrity. Joining us this morning is Dr. Adam Brufsky, Professor of Medicine, University of Pittsburgh. Good morning.
Good morning. Thank you for having me.
Doctor, tell us, how does bone health get affected by cancer and or its treatments?
Well, what happens is that the treatments for cancer, in particular breast cancer is one I'll focus on, actually interfere with the production and the destruction of bone. Bone is a dynamic organ. It's continually being reformed. And when you have particular treatments for breast cancer, particular aromatase inhibitor drugs like Arimidex, Femara, or Aromasin, these drugs can actually reduce estrogen levels in the body, which can increase activity of a cell called an osteoclast, which chews up bone. And so as a result, probably 20 to 25% of women who undergo anti-hormonal therapy for their breast cancer can have substantial bone loss, in some cases to the point where they can actually get a fracture of their hip, spine, or wrist.
Okay, and now the data that was presented was on a class of drug called Bisphosphonates. How do they come into play in the treatment?
Sure, so we've used oral bisphosphonates for a long period of time, and what bisphosphonates do is that they actually affect the activity of these cells called osteoclasts, which chew up bone, and they kind of turn them off. And so therefore the bone can kind of heal, it forms and it heals and it grows back again. What our trial did, this is now the data presented at San Antonio, what our trial did is actually look at a very powerful intravenous form of these drugs called Zometa. It was given twice a year, and after 5 years of therapy, not only did the women have substantial improvement in their bone, they didn't lose bone at all. There also was a hint in this trial, consistent with some results from some other trials, that these drugs may actually prevent recurrence of breast cancer to bone as well. So not only are these drugs preventing bone loss when women undergo anti-cancer therapy, but there are hints, which need to be confirmed obviously, but exciting hints, that they may actually prevent spread of breast cancer as well.
Okay, and was there another study or more data presented there that implies that possibly these bisphosphonates may actually prevent breast cancer?
Yes, there was a large study called the Women's Health Initiative, which is a large epidemiologic study of hundreds of thousands of women. And in this trial, they looked at about 5,000 women or so who had received oral bisphosphonates just to prevent bone loss or as part of their therapy. And it turns out in these women who took the oral bisphosphonates, the incidence of new breast cancer was substantially less than in women who did not. Now, this is very preliminary data. It needs to be confirmed, but it may suggest that not only do bisphosphonates prevent breast cancer recurrence once you have breast cancer, but they actually may prevent primary breast cancer as well in women who've never had breast cancer before. So these are very exciting new pieces of data. They need to be confirmed, obviously, in larger trials, and they are being confirmed right now. But I think that it's a very interesting time now. We started out with drugs to prevent breast cancer bone loss from the treatment of breast cancer, and now have gotten to the point where these drugs may actually, like chemotherapy or anti-hormonal therapy, in a very non-toxic way, they may actually prevent breast cancer incidence as well as breast cancer spread.
Well, that is good news. Now, when you talk about the bisphosphonates, there's oral bisphosphonates and then there's the intravenous. Is there any advantage of one over the other?
Well, I think that, oral bisphosphonates in some cases are generic now. Alendronate, which used to be Fosamax, is generic, so it is cheaper. However, these drugs can be very inconvenient to take. You have to take them standing upright once a week or once a month. You can't lay down or you may get stomach upset. And in fact, compliance with these drugs is not great. About 30 to 40% of women at 1 year will stop taking them or not take them like they should be taken. The advantage of intravenous bisphosphonates is that you just have to take it once or at most twice a year, at least to prevent bone loss, and that these drugs really are a 15-minute intravenous infusion, have very few side effects. A few women may get achiness in their bones and joints. Very rarely, some women can get irritation of their kidneys. Even more rarely, they can have some problems with healing of their jaw after, say, a tooth extraction. But these are very uncommon side effects, and the vast majority of women on these drugs do extraordinarily well. So there are advantages potentially to intravenous bisphosphonates over orals.
Great, great. And where can people go for more information?
Well, there's many different sites. I think there's breastcancer.org, there's Komen.org, or even our website, upmc.com.
Okay, that's great news. Thank you, Doctor, for joining us. And this is Russell Cheek for Good News Broadcast.
Thank you very much, and thanks for having me.